HB 3610 transport and pricing and addiction services, well, CC. And I get you to, it was a little.
Chief Barrett. Don't see him yet. Vaughn Berry.
Oh, see, chief. Excellent.
Okay.
I was just saying, oh,
Oh,
fine, it says.
some phone in there. Sounds like she's trying to connect though. Annalise Dolph.
Here.
Jamie Floyd is not going to be here. Dr. Tom Jean. Oh, he's here. Todd Jeter. Okay. Sean Colmer.
Here.
Sarah Lochner.
Here.
Jana McCamey.
Here.
Director Prince is not here. Marcus Reed.
Here.
Jason Renault. Janelle Romaine. Valera Salazar. Aaron Sarnoff Wood.
Here.
Barry's here. Okay. Quorum is present.
I gave her access.
Here. You should have access.
Yeah.
It's Representative Griffin.
I don't see him yet. Senator Solomon is present.
Okay.
Form berries.
Vaughn just joined. Yes, and there's Chief Barrett.
That is, thank you. Okay, folks,
Madam Chair, just to the record, Rob Corbett.
is in present, in person. I saw your name just before I signed in. I was like, wait, what? I was very excited. Very exciting to see you all, you in person. Well, folks, hi. It's great to see you. It feels odd to see you on a Monday. But thank you for making the time to come and see you. I know that we sort of had it, we created this additional meeting. Yes, thank you for doing that. I don't know what I did, but it makes sense. So I know a couple folks had questions about what we had talked about at one point, was sort of creating a bit of a summary of the recommendations that folks made. And we had a conversation with DOJ about that sort of maybe making a compilation. And the recommendation that was given to us is that we needed to be really clear about the fact that some of what we received was not necessarily all articulated on the public record. So like some of the information that was given to us was not necessarily all spoken out loud in front of God and everybody in this or the other room. And so what we needed to make sure happened was that you all essentially gave permission for that to happen before we would give it to everyone else. I guess that's the best way to articulate that. And so assuring that that could happen in an appropriate manner, I think, is kind of where we're at before we hand it out to everybody else.
And your DOJ's on
small in terms of contribution.
Okay. Does that make sense to folks? So am I?
So Mike, and so, but Christy Munson from DOJ recommended that we, share with you your individual. I think we can do that online as well.
Yes.
Your individual feedback, so we can go over those individually and confirm, for the public and for the public record that this is indeed your recommendation. And, these are the recommendations that you would like to move forward individually. Christy, do you want to follow up with anything, anything that we're saying that?
Thank you, Chair. Thank you, Rosie. The purpose of you having your individual recommendations in front of you are just for notes so that you can remember how you answered, how you thought about these issues. And we're hoping you could have a full and robust discussion about your positions, after which staff will create a compilation of all the recommendations and provide them to everybody. It'll be a public document. And then you'll proceed to your votes.
We don't necessarily need to vote on anything at all today, because again, this is about the discussion and having the conversation and whatnot. Because I really honestly feel like we haven't had time to really discuss all kinds of things. And just clarity, that's the one piece is that whole, that's,
Oh, yeah.
the industry has a larger compilation of everything, right?
So we're trying to sell comments together.
Yeah, they're all together.
Can I ask a question? So the idea is that we're all going to talk about our recommendations today, and then Rosie will send out a compilation of everybody's recommendations. Is that right?
Right, you get a copy of everyone, so that you can actually take a look at all. Yeah,
And then what happens?
well, then we'll sort of get that better idea, I think, I mean, again, part of the reason we're doing it is so we have that discussion. I mean, see what's rising to the top, what's having, what's everybody's recommendation about how we go forward from there. Right, and I think that's really what people wanted to have initially was an overall conversation about where do we go from here? What's the recommendation to the legislature? Right, there's a lot of different ideas that came up, a lot of different thoughts about how we go forward, some of which were, I'll be perfectly frank, I mean, I read some of the things and went, okay, I'm not sure how we do that, but, let's just have the conversation. So,
They're just conversation today, and then we'll see if there's any
Right.
place where we can be on the same page about moving forward.
and then I wanted to go over with you all also just some other questions. So the goal then is to review the draft recommendations and determine if it's still your opinion, right? And then review our task force work plan for discussion, and then a brief discussion on the summary of each presentation, which again, I would like you all to feel free to like individually sort of make that presentation if you feel comfortable doing that. And then following up on the quorum question to kind of according to the House Bill 3610, so the section 1, 6 and 7, and according to the task force adopted rules and procedures document, the quorum, the vote requirements are the same. It means that to call a meeting to order, the task force must have at least the majority of your voting members present, which is 9, I think. And to pass the measure, the task force must have affirmative votes from at least the majority of your voting members. Yes, ma'am.
Solara Salazar, Steel Treatment Center, just a clarifying question. So, when you said the industry has combined recommendations, are we gonna hear each person's individual contribution to that today? I wasn't aware that we were supposed to like band
No.
together.
No, they just made that choice themselves. So that's just, I mean, that's their recommendation. Wasn't a plan, anybody is making anything, that was their choice to make that recommendation like that. Anybody could have, done it however they wanted to. We asked people to make recommendations. ADPC, made recommendations, other folks made recommendations. And as a matter of fact, a recommendation was made by folks in the community. And, the question is, do we, can we accept a public recommendation from folks out in public?
Do we have an answer to that question by the DOJ? Because we haven't had a public comment. have we?
Well, technically speaking, we did. We haven't had a public comment period, but we did have comments from people with lived experience, invited testimony, right? And one of those folks did actually submit some recommendations. And so that's the question. And that I did have a conversation with DOJ earlier and asked that question. And the response from DOJ was, if someone, if I were to say, can I, if somebody would okay that, if someone on the task force would be willing to make a motion to accept public testimony for a recommendation, then we could do that.
Would we reopen a comment period so everyone from the public would have a chance to chime in?
No, I don't, maybe we could. That would be a very interesting idea. But right at this point in time, we've only received one recommendation.
Can I ask a question?
Yeah, sure.
Sorry. I'm just curious, are we going to walk through the questions that we were asked to answer by the legislature? Because, all of the different kind of comments and that sort of thing, I'm not sure, do we have those all put together, or are we just going to talk about them to address each of the questions, or like how? Because it seems like we have to answer those questions in order to fulfill our legislative charge. Like that's the priority. And so I'm just curious how that will work, if that makes sense.
Well, what is the charge of House Bill 3610? Yes, we can go through those. Dr. Jean, you had a question as well?
Yes, thanks, Chair. I was actually just hoping we could move that microphone that's in front of Sarah closer to you and Rosie, because I can hear you most of the time, but it's cutting out a little bit.
Okay, how about that? Does that work?
Sounds better, thanks.
And for the record, Chair, just in conversation with Christy Munson and two questions from Fawn, just kind of how we're going to go over the individual feedback. I think the discussion is that each member of the task force just discuss their own part of that. And from there, the chair makes recommendations to staff and compiling it and sharing that at a later time for the next task force meeting.
And overall, the questions.
The task force questions.
Yes.
So during the meetings, we've had each task force questions were subject for the larger discussion and presentation. And so that's where those discussions were had. And so each member or presenter were compiling the presentation in a summary from the points that were discussed during each of those meetings, not the recommendation. So it's a separate part of the recommendation of the final report overall. So that's one part.
And Rosie, I guess my point was, like, it feels like answering those questions, because that's part of what our charge is. They're very specific kind of outline questions. Instead of having us all present individually, which would be kind of disconnected, like, can we talk about each of the questions and have people provide feedback based on each of the questions so that staff has kind of an overarching kind of view of what different people's views are on each of those individual questions? If not, that's fine, but it just seems like if we're each talking individually, it'll be more presenting as opposed to actually kind of having a discussion.
So it's the task force questions were used for the presentation itself. So for example, each week we submitted into the task force is going to discuss the issues related to this particular part of the charge. So for example, the industry presented on issues related to the industry, whether tax and cost to the industry and the impact there. OLCC presented on the issues related to the taxes we collected. So we use those questions as a means for each of the presentation. So we've summarized and submitted to each to the industry, for example, to summarize the issues that was discussed and to make sure that we are to the charge of the presentation. I think there were two presentations. We also did it with the lived experience folks, share with us whether or not, the summary of those presentation as it applies, and folks have given us feedback. And so those are being compiled and will be shared with the larger task force to have a discussion with those as well. But the issues and the charge, the meetings were the overarching discussion for all the members during that time to hear a presentation and then have a discussion on that presentation. So the charges were the thing that defined each of those 14 meetings.
Right,
And
so to where we get to the recommendations, and so getting to the point where we actually are making these recommendations, that is where we are right this very minute. So it's gonna be, it kind of feels a little bit redundant to me to go back to the actual presentations. We need to be getting to recommendations.
Well, and I guess I was thinking that our charge was more to answer those questions or to respond to those questions. And so the recommendations would be kind of within that, but I guess I'm just looking at it from a different way.
If there's anybody.
Maybe that's the thing we should probably put up. The overview of the work plan.
Yeah.
And each work plan, and you'll see in each of the agenda, we presented the issues that we discussed. Like overall funding of alcohol addiction treatment programs, level of funding, and that was taken directly. And this is to ensure that we are answering the questions or the task force members are answering questions on that particular issue. I think the members remain because the issues to be discussed, they're the experts in this area. So the following meeting, we had March 14th, for example. Yeah, just want to say the skills, picture, right? So the shows are supposed to be investigated. And the presentation for designs was the thing. Some of you heard from Flo, we keep saying Flo, but I haven't been accurate speaking lately. The counties presented on the blind, the impact of the thing. And that's why it was there. Cities did the same. Yeah.
Okay, I feel like I'm gonna struggle with going through all of these again. I don't know. Task force vote. Yes, sir.
Ron Corbett with City of Pendleton. I'm looking at the bill and I'm looking at, item 12 of the bill. The task force shall submit a report, that may include recommendations for legislation. So to me, we've looked at the items that were outlined in the bill. And what we're tasked with is submitting a report to the legislature that may include recommendations moving forward. And so I think the questions that have been submitted to us might include things that we could all agree on, that we could submit to the legislature, that the majority of us agree on this moving forward. And then we might agree on things that may require further analysis. And then we might agree on things that ought to be just thrown to the curb. I would think that that might be an outcome of the work that we've done thus far.
Sarah Lochner, Coalition of Local Health Officials. I'd agree with Rob. I feel like the logical next step is for us to discuss the recommendations, see if we have any common ground, and then that can inform the report. And hopefully Rosie and the OLCC team will give us a draft of the report that will answer all the questions, have the recommendations, and then maybe we can arrive at a vote next week in order to move this process forward. So I think time is short and we're under a deadline, so.
Well, I would also say at this point, yes, we're under a deadline. And it's not as if the legislature has never been under a deadline that they did not move. So I am not adverse to requesting an extension to that deadline. Because I do not think that not want to rush the process. I would like to have the conversation that makes sense. And if we need to extend the deadline and continue to have some conversation, as much as I do, because Thursday I'm being sucked up in my life. Sorry, but I've been testing my Thursday up and it's getting sucked up. I'm sure some of you also struggle with that. I'm not averse to extending the deadline a little bit so that we can actually have a more deliberative process here to get to a better product. So,
the end of the last task force meeting, I believe it was Senator Solomon who requested a full budget of funds allocated for the 21 to 23 cycle and the current 23-25 cycle for all sources of funding for substance use recovery. And I was hoping that we could have that figure in hand put forward as taking kind of a vote, so we know what kind of resources are actually available versus what is just historically spent.
don't really get that.
Yeah, and you can probably, we can do this. I don't know if we're going to have 23.
We might have an allocation, but whether or not we have an actual expenditure.
We don't, yeah, an allocation would be helpful just to know how much money has been set aside regardless of how much it's spent. We talked a little bit about the Measure 110 funds, maybe supporting to the road chase, that for things like roughly half of it is still unspent.
Laura Salazar, Seattle Treatment Center. Although I appreciate the request for additional information, I know that there's additional things I would have loved to have seen. I feel like we didn't get to discuss different tax brackets that other states are doing with alcohol tax as much detail I would have liked. However, I understand we don't have all the time in the world and we're never going to get all the information that we need. So I came to risk acceptance that I would have liked this. We could would have really helped inform our decision. And we're at the end of our, presenting data. So I just hope that we are all respectful of that and we have a lot of data and that we need to keep, continue with that. So,
Thank you for that. I did want to extend the time in order for us to have the discussion of recommendations, not necessarily presentations of more data. Yes, sir.
Sean Fulmer, hospitals, and Rob, I really appreciate you trying to drive us towards prioritization and outcomes. So I'm trying to get a sense for you, Madam Chair. So are you thinking discussion of recommendations and then sort of whittling down? Because I think we would make a giant laundry list of everything everybody wants. And then that goes into a list of a report. And then how does the vote happen for this group? I'm just trying to get a process to understand it for the next meeting. So we all have a good sense of how the discussion is going to go here and then the next step.
Well, let me just say again, the DOJ recommendation was to ensure that we actually had a public presentation of some of the information that came in so that it could be public, because again, not all of it there to me, should be publicly presented. Because they were recommendations that seemed a little bit maybe nuanced or new. And once that happens, then it can be better compiled, everybody can see that information. And then we can do a better job of sort of having more of a compilation and then see what kind of sifts itself out a little bit, and then we can have more of a process of, what's the right word? They just vote, but more of a seeing what rises as a process or recommendations. That makes sense.
Just, could we, sorry, someone, I mean.
Can you tell us who saw the proposals that we submitted? So I had my representative told me that an elected official approached them about my recommendation. So there was some conversation about my submission. So I'm assuming, and you had shared that you have reviewed, it sounds like you've reviewed the recommendations. So it sounds like there's a tight knit group of people who reviewed the recommendations, which made me think maybe that the recommendations have been shared by the group as a whole, and maybe I missed the email.
No.
But so can you tell me who has reviewed the recommendations?
Yeah, that would be the recommendation.
Okay.
So we have not shared.
So no, you're the only OLCC staff has reviewed the recommendations, and you, okay.
And we might talk to individual members about their recommendations, and, you know, some maybe in the timeline. But in terms of sharing the compiled list, no, we haven't.
Okay, thank you.
Senator Solomon, please. Oh, sorry.
No.
Sorry. Senator Solomon.
Oh, okay, sorry, I thought you were calling on Danelle. Thank you so much. I just, I guess I'm just going to reiterate what I had said before, and thank you so much for saying that. I feel like if we're coming forward, we've heard information about what it is that we're lacking and the services that we need to provide. We've heard about, we've, you know, had these discussions for some time. I don't understand how we move forward and come up with a plan, so to speak, of a presentation or a request to the legislature if we don't look at the full ledger and we don't look at what all is given so far and where those dollars go on the accountability side, and then looking at what we need for further prevention measures. I don't understand how we move that other side forward without getting all of the facts as to how much money we're already talking about and where it goes. What does it do? How effective is it? That's just thank you, Chair.
Thank you. So
I had to know, remain with the VR Meister, there's just a process question. When we submitted to the OLCC, it's not a public document, so couldn't you post that and haven't we sort of already said that this is public and we're something that it's okay to release it to the public?
And that's a question for Dear and Jerry as well, because once you send it to us, technically, it is a
Right.
document.
but that's the feedback that we got, so we're trying to
Okay.
do it
Could it just be posted? I guess question for the DOJ, could it just be posted on the website that you have?
with your permission. Yes, indeed.
So considering that it is a conversation, I think we said we're gonna collect the information, compile them. I think that was staff's understanding. And that, but I think DOJ wanted to make sure that we're complying with all the required meeting laws and making sure that we're reviewing them right here in the meeting, that we can all cover. I keep saying we, the royal we, but just so task force members can acknowledge that these are our recommendations. We're agreeing to them and we can go over them individually and share them and discuss them publicly on what the task force members are to move forward. And if the task force members decide that, okay, we're moving the top 5, what are those top 5 that are going into the final report? So, so let me find a secret that's really clear. Yeah.
Okay. Are we good with now that? I would like to actually just go through the rest of these sort of like tail kind of thing very quickly because because otherwise I would probably slide right by them and I don't want to. There were just some details, of the meeting kind of business stuff. Their voting requirements, of course, there are 16 members. The task force has 16 voting members, therefore we need the 9. We need 9 members to call the meeting to order, also need at least the 9 in an affirmative vote to pass any measure before the task force. In terms of any conflict of interest, generally, if a member is voting on a matter that could or would be financially benefit or a deterrent to them, it poses a conflict of interest. And if the matter presents a financial benefit or deterrent, that member must, 1, declare a conflict on the record, and 2, if is prohibited from voting on matter, if the conflict of interest could potentially present a financial benefit or deterrent, then the member must merely declare the conflict on the record, but may still
I
vote.
think it's very similar to this.
Yeah, very similar to the legislative process. So if, for instance, if the legislature is going to pass a piece of legislation that might financially benefit me in some way, I have to declare a conflict of interest. Just is like, or if it's going to in some way be a problem for me financially, I have to declare that it may be a conflict in some way. That's all you have to do. It's just like,
Usually that.
you do not have to recuse yourself. You simply have to declare that it may be a conflict in some way. That's all it is. Just Christie, DOJ, go for it.
Thank you, Chair. Thank you, members of the committee. Just to reiterate what your chair just said, there are 2 rules for conflicts of interest. The first rule deals with a potential conflict. The second rule deals with an actual conflict. Here, because you are a task force that is not charged with making the final decision is going to the legislature if they can get the votes, right? So any decisions you make or actions you take as a task force member could only be a potential conflict. And a potential conflict is triggered when you, your family members, or somebody you live with, or a business with which you are associated stands to make money or lose money based on the recommendations you are making. I'll repeat that. If you, your family, someone you live with, or a business you're associated with, or your dog can make money or lose money based on the recommendations you're making, you have a potential conflict. What you need to do if you have a potential conflict is just declare it on the record at the meeting. So all you would do is before you talk about your recommendations, say, hey, I want to declare a potential conflict. And then you say the nature of the conflict. You don't have to say exactly how much money you'll make or lose. You just say, the nature of this conflict is my family owns a bar and we could lose money or make money on this recommendation. We don't know. It's a potential. So I'm just going to declare it and you just put it on the record and then you're done. And then you can go and talk. You don't have to recuse yourself. You don't have to stand back. You don't have to not vote. If you have an excess of caution, we can discuss that, but those are the legal rules.
So do we have to say that before we talk? I thought it was just when we were taking votes, like an action.
Anytime you vote or discuss the matter, you need to declare the conflict. You don't need to do it several times a meeting. So usually, since you're going to be discussing your own personal recommendations here, I just suggested that you do it before you talk and before we do the round robin about what everybody's position is.
So should we have done that before every meeting? Since there were times that we were talking about things that are part of our recommendations. So
I can't speak to that, Fawn, because I wasn't at those meetings, so I don't know if what you were discussing would have triggered a potential conflict. But now that you're getting closer to making a more official action, you definitely want to make sure that you're declaring as needed.
Janet.
Yeah, thank you. Jana McCamey with the Oregon Wine Growers Association. Just another point of clarification there, please. Because you did mention individuals, family, businesses. How about, leaders of nonprofits that could, be impacted by, if members are lost due to tax increases, for example? Is that a potential conflict?
Generally speaking, nonprofits are excluded from the conflict provisions. However, you bring up a good point. If in fact your nonprofit has membership dollars, let's say, that could go up or down based on the recommendations you're making, and I can't even imagine how that would be affected because I don't know your industry that well. It may be a potential conflict, and all you would have to do is just declare it. I would need to know more facts about how your nonprofit or membership organization works, but there's no harm in just declaring, even if it's not a potential, right?
Thank you.
Thank you.
Okay. Any more discussion on that topic? Okay, we're gonna move on to the next thing. Decisions by the chair. The chair can set the date for the next meeting and ask for a motion to direct staff to summarize the discussion, task force members' positions, recommendations, draft the report, and distribute the next meeting packet. If not,
So the question, the question there, Chair, is whether or not, so after today's meeting.
right.
They direct us to compile that and submit it to the members of the task force. So the compile is, as opposed to we're going to individualize the other.
Does that work for the group for me to set the next meeting and summarize the discussion? Draft.
I vote for yes.
Okay.
Yes, please do.
Clear about that. Right.
Okay, so we'll post it online, I'll make sure that, at the next meeting, yeah.
Okay. That should compile the report with recommendations indicating which ones appear to. Report will be made public, can be shared with the entire task force. Task force members should not discuss the report outside proper public meeting. So don't do that yet. Final report, final vote on recommendation requires the majority of vote. Motions generally, board and commissions limit themselves to single subject motions to avoid confusion and ambiguity while adding several. Let me get to that one. Can vote in bundles of stuff. I don't know that I like that necessarily because I think there's some clarity about issues. We want to put stuff together.
So question there, Chair, and just based on advice, we're looking at each member, looking at their recommendation that they're submitting. And then the question is going over each of those recommendations potentially at the next meeting. And members of the task force determining whether or not they want to move forward with those recommendations. So I might be on someone, because if it was one small recommendation, it might be Sarah Lochner, for example, looking over that specific one and asking folks whether or not, after reviewing all of them, whether or not that's something that's not. So it could be everybody voting individually on each, and I can't remember how many recommendations were made, but it could be say like 20 or 30 recommendations that members vote over and right. And the question is how many will move forward in the recommendation, in the final report, I should say, right?
So what I wanted to be clear about with that piece was, if there are folks who submitted multiple recommendations in their suggestions, if we were to take multiple recommendations, in someone's compilation of things, those are still just recommendations. That we could vote on multiple recommendations in a pile in a page of things. That does not hold the legislature to anything. They are simply recommendations. The legislature will get a pile of recommendations and they can pick and choose and pull them apart. They separate them all out and make any decision they wish to. They would not be held to the recommendations. I hate. Because as many of you know and have been a part of this process for years, negotiations are what they are. And that's, I just want to say it that way, just to be very, very clear. They will be recommendations to the legislature. They simply cannot be substitute them. Yes.
So now let me be reminded with another process question. I remember in our instructions that we were instructed to provide one paragraph of a recommendation, not multiple.
Yes.
So wouldn't somebody like me be disadvantaged if we just followed the directions and provided one and someone else provided 20? And then a report looks like it has 30 recommendations just because other people weren't following the directions that you gave us. So I just want to, I am concerned about that from a fairness perspective, that we followed what you told us to do and submitted a recommendation.
So, Chair, a recommendation, we submitted the letter of ask for drafting a recommendation and provide a summary just off the reason why for that. So that was the, and for the most part, you'll see what everyone submitted, but I think everyone is pretty much consistent with everything. Okay.
Yes, sir.
So for some reason, I'm finding this especially fascinating. The puzzle of how we get from here to there.
Mm-hmm.
And what I'm struck by is the idea that there actually might be some things on our lists that we might all agree on. And it would be fascinating to me if there were things on your lists that we might put out in the room and see if we couldn't start building things that would go into our report that we might unanimously agree on. You want me to go first?
Yeah, go for it.
I agree with that recommendation, Ron.
Go for it.
The number 7, I wrote potential feature act. So number 7 was potential feature action. I wrote key recommendation, Oregon Health Authorities should develop a plan to take us from last in the nation in mental health and addiction services so help me again, you guys are going to have to help me craft this to first. And here's my explanation. We've already sent the message that marijuana use is okay. And I understand that desire to have addicts clean rather than in jail. I understand that. The problem was in the implementation. We should have built out a system to address addiction before we made it so easy for people to get the use of drugs. I know that for many people, incarceration would be better than how they are currently living, because I hear it from the recovery community as they reflect back on how their lives now as addicts living in the streets. Aspiring to be the best in the nation at addressing addiction should be the standard and would make it easier for me to support additional revenues to making that happen.
Aaron Sarnoff with Two Town Cider House. I love where you're going with that. Couple of comments, I think. Well, one, I don't, not to nitpick, but I don't think we ever were last access. I think that was based on some data that was probably not accurate. But I think as far as getting to number one, we have to understand why people are having issues accessing the services they are. And we've looked at, the needs, we've looked at the funding, we've never asked why. Why is it somebody is having trouble getting into your services? Why is it somebody who needs help is having these barriers? And again, I've already brought this topic up times, but I think there is a massive disparity between the privately insured and those on Medicaid.
Yeah.
And I think, without addressing some of those issues, it's going to be hard to improve our access. And again, before we can address those issues, we need to know what they are. So that's kind of where I'm at, is that a comprehensive, effectively this task force, but trying to figure out why people can't get out.
Laura Salazar, Cielo Treatment Center. I appreciate feedback, Aaron. I would disagree. I think that we did present, there was quite a bit of information presented. The OHSC gap analysis is very clear that we're about 50% bed capacity, right? And so, and you can quibble, you can say, no, it's 45%, no, it's 54%, no, we're 47th in the nation, we're 50th in the nation. I think that we're looking at the wrong, you're looking at it incorrectly. The why is if somebody needs a bed, there's not enough beds, right? It's very simple math. We can make it very complicated, and it can be complicated. But the reality is there's not enough beds. How do we get more beds? That costs money. So, I know it seems like it would be complicated, but it's really not that.
Two Towns, again, I appreciate the comments, but I don't know that we know that we don't have enough beds because we never measured them. And the gap analysis report that you referenced relied on the 2020 National Survey of Drugs, which was deemed unusable by the federal government. That piece of data is what they used to make that analysis. So my concern is that the gap report is probably, at least in my opinion, terribly valid. Now, again, this is my opinion, but I think that, that it did employ some potentially useful tactics in trying to understand the problem. But again, without doing an analysis of how often we're using our beds, where are we using our beds? Maybe Portland is jammed up and you can't get a bed in Portland, but maybe that's not true elsewhere in the state. And without understanding that, I think it's going to be very difficult to address the situation.
Thank you, Janelle Romaine, Oregon Beard Wine Distributors. Rob, I agree with your fundamental statement that we're all trying to figure out a solution to a very complex problem. What I would change about it is I don't like the idea of OHA studying itself. I really think we need a third party in here. I think we need somebody who's not affiliated on the industry side or on the side that would benefit from dollars to really figure out what's going on here. Other states are figuring this out. I think we don't need to reinvent the wheel. Let's look at why other states are not spending as much as Oregon is, but having better results in this area. Let's try and replicate that here. I think there's a fundamental disagreement in this group about whether this is really a revenue issue or a structural issue, a systems issue. And I just don't think we're going to solve that here because, from my perspective, after listening to the task force, all of our meetings, I just do not believe this is a revenue issue. I think there's a lot of revenue. We don't know where it's going. Nobody knows whether programs are working. No one is doing that work. And I'm sure the other side would say, we just need more money. We need more money and then we can fix it. Okay, we're not going to solve that here. But I like the idea of somebody really looking at the issue who doesn't have a dog in the fight. And I think that's where we should go.
I'm going to take the chair's privilege and just jump in a little quick and just say, well, here's the problem. I can appreciate that the numbers are what whoever did the numbers. But I don't honestly care what the numbers are. If someone say, counselor, drug and alcohol counselor, and they can't find a bed anywhere for someone, it doesn't matter where we are. If we're 50th or if we're 30th, doesn't matter. If we cannot find a treatment bed, then we have a problem here. That's the problem. If we cannot find and access a treatment bed, it doesn't matter what number we are. That is the problem in the state court. So that number, that 20-point spread doesn't matter, whatever that is. It doesn't matter. We have a problem here. That's a big deal that we cannot find a bed here in the state. We have some serious problems, and that's not just in addictions. That's a mental health in the state. And that's, again, that's not just for adults, it's for kids. Don't have the beds that we need in the state. We know.
You're next.
Okay.
I'm after you, I think.
So I really appreciate you starting this conversation. I think it's good. So whether it's beds or the workforce, I don't think there's a disagreement that we have access to in the state. We can quibble all we want about whether it's beds or workforce, but to the chair's point, we have a huge access issue. So I think that's where we actually, I think we would have common ground in this room. There's a huge access issue. And I don't know if we have a common ground yet on whether we need new revenue. I think we actually probably have common ground on, we have a resource issue at the moment, whether it's redistribution of current resources. We've heard a lot of through line about how the state is using current resources and whether that's effective or not. And I think that's a conversation we should be having. And then if we're still not there when we need access, then there's a revenue conversation to be had. But I think that's where I would appreciate us going is we've got an access issue for sure. And we need resources behind it. So I really appreciate the aspirational vision of we need to get to number one on this. And those are the two places that I think we should start with.
Move on.
So that went somewhere I didn't think it was gonna go, because I just wanted to plan. Because I do want us to aspire to be the best of the nation. So to me, the plan would have the numbers, would have the data, and I agree with the idea of it not necessarily being that it be an outside disinterested or this. I like it being someone else other than OHA doing that. And my color commentary on the state of the situation that we're in. My personal belief is if I'm addicted, if that the people who are addicted to fentanyl today, sleeping under the bridge, would if it were me, I would rather, I believe, I would prefer to be in jail, forced to be in some kind of a treatment or process, rather than being the life that I lived out on the streets today. That's my belief. Yet that we have made it such that I am free to roam around on the streets, and I'm that's no life.
There was a consistent discussion around the data involved in access to behavioral health and access and study. And I couldn't find where the report was coming from, and I reached out to OHA. I saw it in a couple of articles in the paper, but it's akin to discussion around education, for example. The state of Oregon, we didn't measure GED as a way of graduation versus other states. So make a comparison between the states that have a graduation rate that is, say, number 5 or the us we were at the bottom, it's because there are certain things that we didn't count. So what the data showed is that there are certain things in the Oregon measure that weren't counted. So it wasn't a clear, and so it's here in part of the soliciting feedback from folks about their reports is asking specifically about where the data is about. This it wasn't right there. And those, they use newspaper articles, that was one of the issues that came up in terms of the problem. And it will be a part of the longer discussion, I think, when we start discussing presentation and.
Know about access. On has been waiting.
Thank you. Fonberry with the Oregon Wine Council. So I agree with a lot of what both Rob and Sean said. I mean, I feel like there is clearly a problem with access in our state and clearly a problem with how we're addressing these issues. My concern is that over the past several years, we have in fact put a lot more money towards these issues. And if we just keep throwing more money at the problem without figuring out what is why our system isn't working, we're going to be wasting money. So while I understand that there's bed access issues, or we could use more funding for certain things within the system, I think our system is broken. And at the end of the day, if we don't fix the system and just throw more money at it, I just don't see how that is going to be a successful approach.
Aaron.
Aaron of Two Town Cider. I think, again, we talked to your point about funding. I think an audit of Oregon Health Authority's SUD budget, I mean, we just saw recent reporting. We know from ours, 72 million roughly is unaccounted for. I just saw reporting yesterday that 80 million is missing from the behavioral health budget. I mean, large sums of money. And I think more than an audit, just a financial audit, looking at each program and assessing its effectiveness. And that has to be conducted outside of Oregon Health Authority by third party, non-invested party. And I think, again, we're going to find, I mean, just looking through the news, the Measure 110 hotline costs us $130,000 a month. And year to date, for taking 30 calls, from the drug citations. It's something like $15,000 to call, cost to the state. Is this an effective tool, or could these funds be better used in youth education, prevention, or something along those lines?
It's in statute. Yeah.
I understand, but I don't actually. I'm a politician, but a full audit of all the expenses, all the programs to understand what's going on.
People of the state of Oregon voted on it. There doesn't anything to change that.
That's fine.
No, it's not actually.
Oh.
It's actually not.
It's interesting. I take a little issue with that. The legislature can change statute every legislative session. That's what the legislature does. So the voters did vote for 110. The legislature made substantial changes to that, and this could absolutely be part of any future legislation.
Dr. Dean.
Thank you, Chair. Tom Jean, OHA. Just wanted to chime in that, I think we have acknowledged and discussed at length some of the challenges facing our behavioral health system. We've got a long way to go. We are among the worst in the nation, and we're putting a lot of resources towards it. And it takes a while to turn that ship around. So yes, our results are not there, and Chair Sanchez has highlighted this. But I also want to point out that it's not just about treatment, it's also about prevention. And we could be spending a lot more money on alcohol prevention. We've highlighted in our presentation the Community Preventive Services Task Force, which is a group of experts, national experts, and they have a list of recommendations that are strongly evidence-based to prevent excessive alcohol use. And they strongly recommended raising alcohol prices, as well as maintaining limits on days and hours of sale, regulating alcohol outlet density, and recommending against privatization of alcohol sales. And these are some of the things that we're not really talking about when we get bogged down in the behavioral health system. So I just want to highlight that prevention is something that we also need to be thinking about in terms of the revenue that could be raised and spent appropriately. Thank you.
Solara Salazar, Seattle Treatment Center. I would like to go back to Rob's, initial recommendation, and I feel like we could kind of argue and do all of that, but, well, we all have different viewpoints and we have views, but, I think his recommendation, and you can let me know if I'm incorrect on this, was to, have OHA, right, have a goal. And it sounds like if I was gonna add something, I'd say like some, KPIs or key performance indicators, like what would that look like, right? Like, how do we get there? That's shared with the taxpayers, that, I agree with that. Does anybody else? I'm just trying to think if we can come to something that we do agree on that's somewhat, close, that would be nice for someone in the middle, so.
Sorry, go ahead. Okay, so now remind me of your minds to because I appreciate that. Every agency, when they're submitting their budget to the legislative process, does submit KPIs. So that is something that's already existing in the process. What isn't is really this audit, external from a third party. And so that's why the idea again of the agency saying what's working and what's not, when I think there is a trust issue, at least on the industry side with OHA and with what they're presenting to the public and maybe what they're not presenting to the public. I really feel that it should be someone other than OHA looking at the dollars that we have.
Annalise Stahl, Director of the Alcohol and Drug Policy Commission. I'm not gonna lie, this discussion it's a little hard to listen to, because I'll remind everyone that the Alcohol and Drug Policy Commission is charged with improving the efficiency and effectiveness of services in the state. So we've spent a lot of time talking about the Oregon Health Authority. We are not going to solve this issue by focusing only on the Oregon Health Authority. That is not going to happen. We have to look at ODE, we have to look at ODHS, we have to look at OYA. And I wish I could come in here and say, I spent the last 5 years pounding the pavement with our strategic plan and look at the progress we made, but I wasn't there and I couldn't do it. But you have an agency that can do everything that you are asking to be done. What is wrong with the PCG report? Let's agree on what is wrong with it. What else do we want to know about where our money goes? Tell me. I'm developing our next comprehensive plan for the state. So we already have mechanisms to do these things. Say, direct the agency to do X, Y, and Z and bring us back a recommendation that tells us why. So I just want to put that out there that we do have this structure in place. And, we can sit here and micromanage and take OHA apart all day long. No offense, Tom, but they are not solely responsible. We as a state are responsible for the system that we have created, that we continue to fund or underfund. Sorry, Chair, but we are all here for this purpose.
So let me apologize. I did not mean to I don't mean to offend anybody. I don't know the system that's in place to make this functional. I'm simply someone who is from outside the state bureaucracy, who's coming in as someone who reads the newspaper every day and observe what's going on out of the state, at what's going on out in the streets. And I was asked to volunteer to come in here and communicate to you all what I see. And I'm barraged with information, and I've asked to come in here and give you my opinion. And my opinion is that we are failing at a massive level. And I have people who work for me who are going from call to call to call to call to call. I have municipal courts who are overrun. And so whatever we got to do to get from here to there, that's what I think we want. I think you just outlined to us what we want. And so what would be helpful for me is to know what you just said and to put it into words so that I could, next time I ever say it again, you know what I want, right? I think you know what I want. I just don't know how to say. But I want us to be the best. I want my children to grow up in a state that their children can have the best chance of living full and productive lives, and my neighbors aren't impacted or prone to risk. So whatever that is, that's what I want. And I think we all want that.
That sounds like we all want to reduce substance use disorder prevalence. I hear that. That's my.
Yes. And so to me, I want to see a plan. And my problem is, I think I've heard it before, is just coming up with more money and throwing it out there. Because where I come from, I run city. And what the state said is, we're going to give everybody, we're going to decriminalize narcotics. And we're going to take away a bunch of your money that you use to pay police officers and ambulances and municipal courts. And we're going to build this massive treatment system to deal with all these people that are addicted. Because addiction is addiction is addiction. These treatment centers are dealing with people who are addicted to alcohol and fentanyl and all these things. And then they didn't get, and they created all these addicts, but the system to deal with it isn't there. And we heard about all the, the bottleneck of the treatment system not being put into place. And so it feels like the system isn't working. And so before, I want to know that the money's put out there so that the treatment is being produced. To me, there's still a mountain of money somewhere to build treatment centers, which I don't know if it's there or not. But before I give the state more money, it feels like we should. I'm cautious about just saying, yeah, just give more money. That's where I come from. And I'm sorry, I don't mean to step on toes, but I've had my toes stepped on too, so I get.
So, get to everybody online in just a second, but I do want to say that, thank you, Emily. And I'm so glad that you are PC now. And for those of you who are not aware, PC has been around for a minute, but it really would be important to look at the overall charge of the fee. In 2018, ADPC was not doing much, anything. No fact. And I received the bill essentially to put a date on the ADPC to actually do something, charge them, put their damn report out, getting something done. And we made it happen and started to roll the darn thing. And then Measure 110 brought on top of the actual work. So it really did a bit of a damper on the role that we're creating the agency. So it's a very long history of what it could have and should have been being done with that. That commission for quite a while, but it's really actually has the potential to do some amazing things. And if you look at the overall charge of the agency, you have the potential to make some really amazing work happen there. And Lisa is the perfect person to move that on. Lisa, Fawn first or Chief Barrett? I'm not sure. Oh, looks like Fawn was first and then Chief Barrett. Please go for it.
Well, I was just going to say thank you, Annalise, for mentioning the Alcohol and Drug Policy Commission. I would love to sit down at some point and just talk through some of these things that we have been asking questions about. And there was a great article or an opinion piece, maybe it was an article, by the psychiatrist, the state psychiatrist at OHSU, where he talked a lot about the fragmentation of our system and how there are other states that are, spending the money from the state level, and they are able to, I think, measure outcomes and measure, accountability and figure out what is working and what isn't in a way that is very different here. And I feel like some further analysis of who are those top 5 or 10 states and what are they doing that makes their system work compared to how we're doing things could be invaluable. I mean, that's the way that that you develop good policy is by looking at who's already done it well. And so trying to, from my perspective, the fragmented system and trying to figure out whether or not the way that we fund these services today is the way that we should fund these services would be a really important step to take. And I would just add, I was on a CCO 6-hour call today with Representative Nose where we were talking about these issues. And there was a lot of discussion back and forth with the counties and with the CCOs about, how they are funding behavioral health treatment and whether or not CCOs should be doing more. And I keep saying, I really wish we would look at what services are counties doing that they're receiving money directly for, and is there a way to put that money through the CCOs in order to get federal match? I mean, that's a lot of money that could be driven into the system that is money that we're already spending. And I think the concern that we always hear is that, counties use that money for a lot of different things. They don't want a kind of one size fits all. But at this point, I feel like we just need accountability for those dollars in order to figure out, what the best approach is. Because we want to make sure people who are getting treatment, it's effective treatment, and it is, being as cost effective as possible. So from my perspective, that would be a really important step.
Chief Barrett.
Can you hear me now?
Yes.
Okay. Been doing this for 25 years and one of the reasons I joined this to figure out what we're going to do, how we're going to change it. We need to change something. We need to change something pretty drastically to get people into treatment. Oregon wrote a paper, Lane County wrote a paper a couple years ago now, I believe, that we're not going to put people in jails anymore. We're going to put them in treatment. Well, where's the treatment facilities? Where are those being built? They're not. We still can't get people into treatment. And dual diagnosis is what we need more than anything. Every one of my clients that I've helped get into treatment need mental health. We need more mental health. Then we could cure the alcohol dependent possibly problem. I don't say we're ever going to cure it, but we need something else to change so we can start helping some of our people. We can't get people into treatment now, let alone 2 years ago. And, they're supposed to build all these and they haven't built anything. So I don't know where they're going to or when they're going to build them, but I'm still waiting to try to get people into treatment. Thank you.
Okay. Well, 13 minutes till 5. Any other recommendations? Solar.
I have a suggestion. I could be way off base, but it appears to me, and thank you, Rob, for going first. It's very brave of you. I was like, I wouldn't want to go mine first. But it appears to me that the system of sharing a recommendation and discussing it might not be the best use of time. Just a suggestion that we do compile all the suggestions and we have them on a piece of paper, because what if there are suggestions that all sides of the aisle are aligned on somewhat, right? And then we might have to verbally, go 6 months down the road to get to that, versus if it was just all laid out, it would be, I think, somewhat easier to say yes, yes, no, no. Yeah, I don't know if that's makes sense to anybody. I know, Chair, that this is your structure, but I think just having a different structure that.
It's fine. I mean, again, you were just concerned about, the DOJ's concerned about everything being very, very clear and transparent in terms of the public record. Public information kind of situation. So if people are fine with what they attributed being, identified as on the public record, then we're good. And happy to sort of minnow down the information as much as possible to folks. But, oh, she's talking. Dang it. Thought I was going to get away with that. Yes, Christy.
I'm really sorry. I'm sorry that I became a lawyer, but the real challenge is we want to comply with the public meetings law. And so if you developed your recommendations in private, and then everybody's filling out recommendations on their own, and then we compile them in a way that all the voting members can see where everybody is leaning. That is the type of work that needs to be done in open session. So to the extent that you've discussed all your recommendations and then staff is merely taking the meetings of the minutes and compiling them, you've discussed those in public meeting and you would be compliant. To the extent that you haven't done that and haven't had those discussions in public, there is a concern that someone, and I'm not saying that this argument would be entirely correct, and I know you would have defenses to it, but given the new public meetings law, somebody could argue that the survey taking and writing down of individual opinions and compiling them is assisting you outside of a public meeting in making your decision. And that's not how Oregon wants its public meetings to be formed and how your decision should be made. So that's why.
What if we just post the survey results onto our public site? I mean, isn't that, is there any problem with that?
The survey results, I believe, would allow each member to see how other members are leaning.
Right.
And that's the work that needs to be done in a public meeting. Those are the discussions that need to be had in a public meeting. You cannot, the Lane County Handy case, which was codified last year, disallows government making sequential decisions privately. And so it could be argued that by taking these surveys and not discussing them in a public meeting, you've done that. I also want to say that to the extent you've already discussed these issues in a public meeting and staff is merely compiling your comments, then you're okay, right?
Okay, so Christy, you keep saying the word survey, and I don't think we've actually done a survey.
Okay.
Okay, we've had multiple conversations. And people have made recommendations. And so when I ask the question at this point in time, is anything that you all have written in your recommendations, have you not discussed those at this point in time? Is anything that you have? Okay.
Yeah, I mean, Annalise, Alcohol and Drug Policy Commission, like, obviously, we think about substance use disorder all day, every day. So when you ask these questions, yeah, we wrote 6 pages. Like, so no, like, there are things in here that are like, for instance, if you had a sustainable revenue stream to support primary prevention efforts statewide, here's some things you could spend your money on. So like, that hasn't been discussed in here. The idea that we would spend money on primary prevention and youth intervention has certainly been discussed in here. So I don't know how much you're parsing this.
Okay. Okay.
Right. Danelle Romaine with Fair and Wine Distributors. I don't know that we discussed did we discuss all of our recommendations? And we might have in some of the presentations, some of the industry presentations, but
go ahead. And trust me, Christy, everybody knows what Erin thinks. Everybody knows.
That's not a bad thing.
True.
So I guess I'm just a little confused about if everything that everyone thinks is posted on a public website, though, that's still not considered public.
That, I think you're leaning more towards the public record side. I don't have a concern about the public record side. Everything that the documents that you're creating, my discussions with staff and the chair are that they're going to be public. What I'm talking about is the public discussion and coming to agreement and eventual vote of the task force, and not having those discussions take place outside of a public meeting.
Dr. Drew.
Yeah, Tom Jean, OHA. I just wanted to chime in. I think what we've done so far is each task force member has worked, with their, on their own side to come up with the recommendations and submitted them to OLCC staff and the chair. And then if we can all put those together and discuss them here, like this is the place to discuss it, right? We have to have the public discussion here in the meeting. But I think the fact that we worked on these privately and our recommendations may not have, or we may not have already discussed everything that's in our individual recommendations. I don't see that's a problem with the public meetings law, but we certainly, like, this is the venue for us to discuss all of our recommendations. So whether we need to, I guess the one question I have is if we could post them after the meeting and we review them on our own, and then at the next meeting we discuss them, is that okay? We obviously can't have side discussions outside of the meeting with other task force members because that would be a separate meeting that's not public. But does that make sense? I feel like if we can share them now and then actually have the substantive discussion at the next meeting, that seems like it would be okay.
Given the new changes to the public records law, there is a risk that if you post your opinion about your recommendations, each individual voting member's opinion, it could be construed just as you would a sequential email conversation that you've had with people. Hey, I like proposal 1 and 2. Oh, I like proposal 3 and 4. And that's posted, but it wasn't done in a public meeting. The public meetings law requires that the public's business be done in a public meeting. There is an argument that you're merely posting a document. However, I personally would not want to be before the Oregon Ethics Commission making that argument if I were you. So what we try to do is find some middle ground to help this committee do its good work. And so the middle ground, which doesn't appear to be working, is that everybody could talk. Hey, my recommendation, I liked recommendations 3, 4, and 5. What did you like? I like 6, 7, and 8. I had a problem with 3 or whatever it is, so that you could get it down, discuss it, and then have a document that's much like your meeting minutes that kind of compiles everybody's, and then you can have a more vibrant discussion and vote using that document. That was the intent.
But we don't know what others submitted, so we can't talk about it like recommendation 1, 2, and 5 because we don't know what any of those are.
I was hoping that each person would discuss their recommendations at this meeting and that would solve this problem. I haven't seen that occurring.
Well, we each have 7 recommendations that are a paragraph each, so or more, so that could take a while.
Well, I don't think everybody has 7, but or something.
What if we each read the headline of it? And does that cover it in terms of like the topic?
Okay, so
I don't.
Okay, so let me suggest this. I know that Rob has said. But I will tell you what, just like I asked Annalise, is there anything in your recommendations that specifically you can recall or whatever that you have not discussed in public? Or you said you mentioned something that, Rob, I think I'm looking through this and most of this stuff in here, I know you've discussed in public, right? We know we've discussed it. We go through your points. Go through your points. Tell us what you know, we've talked about this, we've talked about this, we've talked about this. Please just go through it very quickly if you would, please, so that we can.
So I don't think I've said publicly, I don't at this time support an increase in taxes. I think I've discussed my concerns about the taxes with Measure 110. Everything else I have discussed in the meetings. Yes.
Okay, I know, first mine are much longer. So on the first point of alcohol pricing, addiction, and taxation, potential impacts of increased taxes on beer, wine, and cider. I just said that the current state strategic plan does support increased beer and wine taxes, as well as reallocating marijuana and alcohol revenues to increase access to prevention, treatment, and recovery services. Any increase in taxes must take into account disproportionate impacts to specific populations. Two, addiction treatment and prevention services, strategies for effective alcohol prevention and treatment, including gaps in needs. I have several paragraphs citing all the studies that we have cited to. So I have kind of two recommendations there. For the task force to support primary prevention and youth intervention to be supported by any new revenues. Create a sustainable revenue stream to support primary prevention efforts statewide. And there's some examples from some work that the opioid settlement board has done with one-time funding. Support school-based prevention and intervention work, including looking at some models that provide universal expert screening, brief intervention, referral to treatment, which would require training and technical assistance. Specifically, direct the ADPC in collaboration with OHA, ODE, County Corrections, and OIA to inventory and assess feasibility of scaling up school and juvenile justice-based substance use screening, intervention, and referral programs. Support school districts and education service districts to pilot implementation of parental, caregiver, and peer resources for prevention education and early intervention on alcohol use. Kind of part B to this recommendation for prevention and treatment is, so the overarching thing to take a step back from us is if you are going to allocate new revenues, they should go to things that we are not currently funding. So primary prevention and recovery services. So kind of the last bucket was prevention, recovery, continue to support recovery high schools. Something you'll probably see in our next strategic plan, supporting recovery hubs statewide. This is an emerging state model. Let's see, what else do we have? Distribution of resources. I give a pitch for our policy option package to sustainably staff the Alcohol and Drug Policy Commission. Folks who don't know, we have 4 staff, and we're trying to sustain 3 additional staff. That is to oversee alcohol and drug policy across all 14 state agencies. Overall funding and everything, public education and prevention, just like best practices for public education and awareness. Again, making sure that we have the inventory of everything and funding that. There's currently not a specific strategy or funding to support this effort. And then data collection and research. I don't know, Erin and I may need to compare which one of us has more suggestions on this. We have about a page and a half to look at gaps in our prevalence data that include severity of disorder and treatment gaps to get better data to understand, which I'm guessing is probably something you line on. Improve data on the availability of residential treatment, withdrawal management, hospital, outpatient provider openings, et cetera. Compatible electronic health record systems do not currently exist, so funding incentives in support of a system for compatibility. Define metrics and research methodologies to measure stigma and pathways to recovery. ADPC data dashboard. And I give some other state examples of statewide data dashboards. That's all mine.
Thank you.
We're just going through all of them. Is that the plan?
Darn right you are.
All right. Okay, here we go. For alcohol pricing, addiction, and taxation, we've seen overwhelming evidence from Eco Northwest, the senior economist, and real world examples in Illinois and Maryland. The taxes do not reduce excessive consumption. They're not generally effective at reducing consumption in general. We know that with taxes not curbing problem consumption, the state should increase the use of existing tax and markup revenue beyond the current 3% to fund proven and vetted SUD programs. Let's see.
And again, we've already presented this.
Oh, this is just new stuff.
New stuff.
Yeah.
Sure, you don't want to hear it again.
No, I don't.
I think the biggest thing that I saw or that I remember, we hadn't discussed an inventory of school districts and what they're doing around prevention programs. That was something that we had put in comments.
Yeah, if there's new stuff, you don't have to be able to deal with stuff.
Well, here's something new. So just to back up, we all six of us in the industry side submitted comments together, so it's all in one document just for process,
Right.
everyone
Yeah,
gets that.
so just whatever's new.
So I think, and this is consistent with what Rob said again, OHA does not track money after it's spent or hold providers accountable. OHA does not collect the minimum data necessary to determine gaps in service. No data is collected regarding recovery asset utilization rates, outcomes resulting from recovery treatment, insurance barriers, existing prevention programs statewide, or public health benefits from recent increases in recovery funding. So we're asking for a third-party audit study to get to that information. Distribution of resources, we talked about less than 3% is earmarked for mental health and addiction. Oregon can improve distribution of resources and coordination, and this is something I think that Vaughn just mentioned. If we had a more effective central hub at the state level, as recommended by experts, Oregon could take advantage of more federal matching funds. And that's one of the issues of our siloed approach, that we have different addictions in different buckets, so we're not really able to take advantage of federal funding in the way that we should. Overall funding, SUG funding has increased 100% since 2021, over 1 billion, and we don't know what we have to show for it. Again, this is about data collection, public education and prevention. We talked about OLCC alcohol licensing training programs, so it should be examined for best practices. The legislature should investigate substance use disorder curriculum for school education programs. This is already mandated in state statute, but I don't think we had any presentation on what the different school districts are doing in terms of their prevention and substance use disorder curriculum. So that might be interesting to see what are the different school districts doing if the focus is really on kids and who's doing what and what can be done better. OLCC should use existing alcohol tax and market revenue to ensure they're adequately enforcing Oregon's numerous alcohol control laws. This is to what Craig got into in his presentation. We have all these laws on the books about when alcohol, where alcohol can be sold, when, all of that. Does OLCC have enough in terms of enforcement dollars? What's OLCC doing right now to enforce the alcohol laws on the books? And I think we talked about this data collection. We could trust the third party. We talked about data. We need better data.
Nothing new for me. You've heard from me. Thank you.
Mine's not new, but it's pretty short. So my recommendation was to recommend a point of sale tax increase on beer, wine, and cider that will raise enough money for a meaningful investment in youth primary prevention for local public health and tribal public health, as per our statute, directing us to prevent chronic diseases, and also to invest in youth treatment and recovery services. Because ballot measure 110 funds adult treatment and recovery, it is not funded.
All right, Florida Fellow Cielo Treatment Center. I'm deviating slightly from what I wrote down. I wanted to acknowledge that. I did some research after the fact and then let them make recommendations. I disagree with my own recommendation. That's wrong. I have to say that. I was making that recommendation. So I would like to, my recommendation is a point of sale tax. My recommendation is a progressive tax rate. And I recommend that the funds are specifically allocated 100% of revenue generated from alcohol tax earmarked exclusively for youth primary prevention services, including culturally specific services and curriculum, youth substance use services, and recovery high schools. And then another recommendation is a portion of the revenue. Well, I know I just said 100%, so back up on that. Let's see, funding pilot programs and research initiatives that evaluate the effectiveness of different prevention strategies, ensuring the most effective methods for scale up. So somewhat similar, that's why I'm glad we're being used. Some of these can be some kind of agreement on. Next, allocating funds based on population, distributing the revenue generated from the alcohol tax. I'd like to go to the AEPC. And then have it be population-based, ensuring that it's not all going to Portland, right? That each county has needs, every county should have prevention, every county should have, recovery high schools. Not just the Portland area. Therefore supporting the needs of rural communities.
Anybody online? Anybody who submitted a recommendation or any of the members, task force members, can you have a recommendation that you submitted or make your recommendation now so that you can get that on the record? Dr.
Can I
G.
recommend we change the public records or public meetings law?
Dr. G.
Thank you. So I'll try to be quick. We have a lot, and some of them were discussed, but I'll try to highlight the key points that were not discussed. So number one, we recommend to increase the beer, wine, and cider taxes and index them to inflation, and to dedicate the new revenues towards effective prevention, treatment, and recovery programs. And that recommendation is based on the Community Preventive Services Task Force, which is in turn is based on a systematic review of 73 studies that showed strong effectiveness of this policy in reducing excessive alcohol use and related harms. Regarding addiction treatment and prevention services, I recommend to make investments to equitably address prevention and treatment gaps as identified in the SUD fiscal analysis, and that includes strengthening local and county prevention programs, funding recovery supports and peer services, additional peer and parent mentors to support children, youth, and families impacted by substance use, and directly funding culturally and linguistically specific CBOs, tribes, and Oregon's regional health equity coalitions. In terms of distribution of resources, we recommend to ensure foundational local county prevention program infrastructure and expand culturally specific services and supports provided in rural and rural remote communities. In terms of overall funding, we recommend generating new sustainable funding sources for state, tribal, and local government programs across the SCD continuum of care and dedicating funding for comprehensive substance use prevention programs. Regarding public education prevention, we recommend to develop and implement and continue to do so regular paid media campaigns that are sufficiently funded for statewide mass reach. Funding and supporting local and county level effective prevention programs, including culturally specific community-based organizations, regional health equity coalitions, federally recognized tribes and tribal serving organizations, increasing youth engagement and leadership in the OHA and other state agencies, youth advisory committees, and school-based programs to ensure culturally responsive and youth-directed prevention efforts. Regarding data collection and research, we recommend dedicating resources towards a robust, coordinated, and sustainable behavioral health surveillance system that addresses the specific data needs for population-level prevention, harm reduction, treatment, and recovery. And finally, for potential future action and aligned with the community guide recommendations, support evidence-based actions to reduce excessive alcohol use and related harms at the community level, consider other pricing and tax strategies to further reduce excessive alcohol use, and fund prevention, treatment, and recovery efforts, and explore other evidence-based interventions that are shown to be effective, such as a 0.05% blood alcohol content per se loss. Thank you.
Thank you so much. Okay, folks. Woo! Jason, is he on? Jason Renaud?
About me.
Oh, good. Barrett, go for it.
Okay. Mine's a little bit condensed version, but I kind of almost agree with everybody there, but I'll just throw in mine. More treatment and dual diagnosis facilities. I think you guys already heard that from me.
Yes.
Keep positive prevention efforts going. Raise taxes as needed for more youth services for treatment and prevention. Money for county and tribal prevention gaps. Cultural specific prevention for tribes and rural areas. Because we don't seem to get anything out in our little areas, and like somebody else said, most of the money goes to Portland and Eugene. So please send some over the mountain to us also. Thank you.
Thank you. And I wasn't seeing Jason on there. Was he not there?
You got on earlier.
So I am going to read his recommendations out loud. For the record. You okay with that, Christie?
I am.
Okay. Making sure. Okay, alcohol pricing, addiction and taxation, potential impacts of increased taxes on beer and wine, or does it just, oh God, this is just, okay. This is. Summarizing. Okay, summarizing that points, okay. Somewhat sympathetic to Oregon small business individuals manufacturing, but since they already pay no tax, that's not true. And have little regulation or oversight should have further exemption from tax or regulation in favor of increasing alcohol tax to match the cost of impact, in favor of continuous independent study of impact of all types of alcohol on Oregonians and Oregon businesses, use generally accepted research standards to measure the impact of harm on alcohol and to adjust taxes up or down as time goes on. Strategies for effective alcohol prevention and treatment, including current gaps and needs for local addiction treatment and recovery services, distribution of resources, and allocation and utilization of resources for addiction services. Exclusively interested in additional tax providing medical treatment for alcoholism and also supportive services for people who are actively moving towards abstinence-based recovery from alcoholism. Inpatient treatment as needed, both long-term and short-term inpatient treatment is needed without witness or barriers. Workforce needs to be refreshed and revived, especially in areas of quality. And it is not sufficient to certify all who pass a test. Not sufficient to certify all who pass the test. Drug and alcohol-free housing is needed in all areas of the state. Specialized treatment services are needed for people with intellectual disorders, people who are underage, for people who do not speak English, for people who need psychiatric care, for people who have traumatized by homelessness or imprisonment, for people whose gender does not conform to the majority, for people with alcoholism or drug addictions, for people with sex addictions or gambling addictions. Social programs for people under 21 are needed, as are recovery high schools. Support programs for family members and loved ones are needed. Finding job training and placement are needed. Many of those services and supports could be managed through already existing programs. So both paid to provide services and supports and education. Overall funding impacting alcohol pricing and potential taxation on consumption and addition rates. Taking taxes can reduce consumption of alcohol. Okay. Public education and prevention, best practice for public education awareness programs, including community-based prevention services. Unaware that what Oregon currently refers to as public education provides any noticeable impact on reducing alcoholism. Data collection, challenges and needs for improvement in data collection and research methodologies related to alcohol addiction in the Con Northwest. Methodology for surveying the impact of excessive alcohol use was not one generally accepted by other national and world alcohol researchers. I suggest those commissioning further alcohol impact research discuss more standard and accepted methods for experience and established research. I agree with that. Okay.
Chair, for the record, we did not receive the recommendations from Director Perkins. They also see and Todd Cheever from the community organization, CCOs, and we received verbal from Chief Doug Barrett.
Right.
So one of the safety.
Okay. Anybody else is good? All right.
Chairman, it's just stated for the record and for public meeting laws and everything else to make sure we're about, just to make sure that we probably at the next meeting should have members just kind of release it that they did not submit and then we're not, they want to submit for the record and whether or not anyone that already submitted, whether or not it's.
Yes. Yes, if we have changed our recommendation or want to put in additional anything, shifted anything, I don't want any more additionals unless you really must. But if you've changed anything in your recommendation, I really would like to know that as soon as possible, Solara. But and if we could adjust that. So we can file. Right? With these, that would be helpful to us, although I think we probably have the recorded version, correct? Thank you. Dawn?
I just wanted to, for the record, declare a potential conflict of interest just to cover the bases because I felt like that's what we heard earlier. I represent a nonprofit and my husband also owns a small winery.
Doing that, should we go around the room?
Go for it.
I'd like to declare a potential conflict of interest because I own an alcohol producing business.
I'll declare a potential conflict of interest representing beer and wine distributors.
I don't provide these services, so there's no conflict. Actually, this is going to reduce the number of adults that I get my treatment program, so this would potentially harm my bottom line, my revenue.
Potential. All right, very good. All right, Jenna.
Yes, I'd like to raise a potential conflict because I represent Oregon wine producers.
Okay, folks, and did you were saying okay for next sentence? No, we're done. Okay.
Can I ask a follow-up question? You mentioned at the beginning that when you shared the presentation from the folks with lived experience, that they had a suggested recommendation. Was that something that was covered in their presentation?
So I think it was Jesse Cornett from the Oregon Recovers, who also provided testimony during the lived experience. And he shared his experiences. So I think for the most part, we probably need to open to a public comment period on the recommendations, if that's where he could potentially,
And he's not here today.
So is that the opinion of council that we have to have a public comment? Opening that up for everyone? Like, I'm just trying to understand, is there going to be a public comment?
Where is?
I don't think that they would. Can't you just post that one? They're not a part of the task force.
I don't know.
I can speak to that if the chair would.
If you would, please.
My advice regarding the task force adopting any recommendations that aren't from members of the task force is that that can be done in a motion when you vote to move any of your ideas forward. And so that would require a motion, a second, a discussion, and a vote.
But I think we were trying to see if we could compile them so we could all view them. Can't they just have it posted since they're not a member of the task force?
I was under the impression that they had already presented to the task force and those comments were already on the record.
No, they were a separate they had presented to the task force, but I think what they made was recommendations based on the presentations like everyone else did to the task force. They may have made some of those same comments, but I believe they made recommendations very like what the rest of the task force made. So I wouldn't necessarily think that it would be, I think it would be recommendations for legislation, not necessarily. And again, they made recommendations in that meeting, but I think these are probably different. Are not really, I don't know if I could say that they were different. I would say that they're probably more aligned with an actual, like, this is what I think should happen kind of situation versus this is what I think, this is what happened to me. This is what I believe is you know, a going forward kind of situations.
So those can be shared with the task force members. I would caution the task force, it should be a one-way sharing. It shouldn't be sharing it and then the task force members each discussing it sequentially. But it's just a document that you share and you can consider it and decide whether you'd like to adopt all or part of it and make motions as needed.
Thank you. So that will be distributed to you all and you can that determination. Okay, perfect.
So for the next task force meeting on August 29th, all of the, goes to the list of all based on, DOJ's advice.
Right.
A list of recommendations and determine, maybe that's when we'll have a survey and so members will survey which will be the top 5 and 10 recommendations that gets into the final report.
Okay.
For the draft report, I should say, but it will be the final.
Yes. Okay, that makes sense? All right. 4.5 minutes to spare, people. All good, no more? No more hands? Sure, adjourned.